Welcome, everybody. I would like to welcome you to the sixth session of the Solid Talk series. Today, we have a presentation of Dalida Mukasheva of Eurasian National University in Kazakhstan, in Astana, and we will hear more about a comprehensive approach to supporting women in detention in Kazakhstan. This reflects also Dalida's dissertation that was conducted in the framework of the SOLID project. We are very happy that you managed to work on this difficult issue and that you managed to defend your PhD dissertation so successfully in September. So the whole team of SOLID is really proud that this was possible, that you wrote such a great book on these topics, and also that you published articles and will continue to do so in the future. Now, of course, we are really very interested to learn more about on what you are currently working on. So, Dalida, the floor is yours.
Hello, everyone. Thank you to be here today. Thank you for this that you allow me to present some of my results and plans for research in SOLID 2. So, as Professor Ula said, today I would like to focus on one specific group within the penitentiary system, women in detention. And very often prisons are discussed as gender-neutral institutions. But in reality, imprisonment affects women very differently from men, physically, socially, and psychologically. This session is about why women in prison should be seen as a particularly vulnerable group, and why a comprehensive approach combining healthcare, social work, and post-release support is essential, not optional. This topic is especially relevant for the SOLID project because it sits at the intersection of drug use, health, social exclusion, and institutional responsibility. I will structure this session around 4 questions. Why women in prison are particularly vulnerable, why a comprehensive approach is necessary, what main problem they face, and how drug use and HIV significantly exacerbate their situation. So, globally, more than 700 women and girls are held in prisons. Compared to men, women in detention have higher rates of HIV, more unmet reproductive health needs, and more limited access to healthcare services. Many are mothers, many have experienced violence, and many enter prison already in poor health. What makes the situation more complex is discrimination and, of course, stigmatization, both inside prisons and after release. As a result, women often leave prison with more problems than they had before incarceration. The data from Kazakhstan clearly illustrate this vulnerability. A very high proportion of women live with HIV. So many use drugs before or during imprisonment. More than half didn't receive medical care before arrest, and the vast majority didn't receive any structured support before release. This study included 65 women living with HIV and with the experience of imprisonment, mostly between 30 and 50 years old. Over half are mothers, but many lose contact with their families during imprisonment. Unemployment and low levels of education further increase social exclusion after release. And importantly, drug use is not a marginal issue. For many women, it is a long-term coping strategy linked to trauma, poverty, and a lack of alternatives. One of the most striking findings concerns support before release. More than 80% of respondents said they didn't receive any support at all. When asked what kind of support would be most useful, women most often mentioned professional training, employment support, and psychological counseling. These tell us that women are not asking for abstract help, they are just asking for practical tools to survive after release. Health issues are central to this discussion. Many women learned about their HIV, hepatitis, or tuberculosis status only during imprisonment. This showed that prisons play a key role in diagnosis, but diagnosis alone is not enough. Without continuity of care after release, treatment is interrupted, risk increase, and of course, health inequalities deep in. If to talk about international research, most of them confirms these findings, such as UNODC reports highlight violence and discrimination against women in detention. WHO recommends harm reduction and integrated social support. These issues directly relate to SDG 3, 5, and 16. In other words, improving the situation of women in prison is not only a national issue, it is part of global development and human rights commitment. Psychosocial support is one of the weakest points in the system, and most women didn't receive social support, didn't receive financial assistance after release, and had limited information about NGOs or services that could help them. International standards and comparative evidence show that effective resocialization depends on two things. The first one is preparation before release and sustained support after release. When one of these elements is missing, reintegration becomes freedom. According to the Nelson Mandela rules, all of you, I think, faced with this international standard, social support, preparation for release, and coordination with community services are core elements of human detention. However, in practice, these functions require a professional actor. In Kazakhstan, this role is not institutionalized, unfortunately. There is no social worker in the penitentiary system who would be responsible for this task. As we have just seen, psychosocial support is one of the weakest elements in the system. Most women don't receive support before release, have limited information about services, and are left alone during the most critical transition period. At this point, it is important to ask why these gaps persist. So they are not simply the result of limited resources or individual failures, they are largely institutional. Social workers play a key role in helping people understand procedures and opportunities, prepare for release, and navigate complex systems. Social workers, they reduce vulnerability by providing orientation, individual support, and continuity. Most importantly, they bridge prison-based services and community support, ensuring that assistance doesn't stop at the prison gate. During the first phase of the SOLID project, we systematically studied these gaps, yes? And this included analysis of the legal framework and international standards, as well as empirical research on women in detention, focusing on HIV, drug use, health, and reintegration. So the key conclusion was clear. Despite existing standards, social work is absent as institutional mechanism in the penitentiary system in Kazakhstan. And as a response to this finding, one of the key outputs of the first phase was the development of a professional profile and a competency card for a social worker in the penitentiary system in Kazakhstan. This profile is based on real needs identified through research and aligned with international standards. In the second phase of the SOLID project, the focus shifted from analysis to implementation. And a memorandum, we have a memorandum right now with Ministry of Internal Affairs, memorandum of cooperation has been signed, and trainings are being conducted for staff of closed institutions in different regions of Kazakhstan. At the same time, work is ongoing and on the development of professional standards for a penitentiary social worker. In this way, SOLID demonstrates a clear pathway from research to institutional response and practical implementation. This brings us directly to the decision and recommendation presented in the next slide. Based on these findings, a comprehensive approach is needed. So this includes temporary housing, employment, and vocational training, legal literacy, and access to medical service, of course. NGOs and volunteers organizations play a critical role and needs institutional and financial, of course, support. Equally important is the adaptation of international standards such as the Bangkok rules, Nelson Mandela rules, and the development of social work within correctional facilities. Psychosocial intervention, counseling, cognitive behavioral therapy, peer support groups, and essential for long-term change. To conclude, women in detention represent one of the most vulnerable groups with the penal system. Strengthening social work and ensuring continuity of care before and after release are key prerequisites for protecting human rights, improving health outcomes, and supporting sustainable reintegration. So a comprehensive approach is not an ideal, it is a necessity. Thank you for your attention, and I am ready for your comments, maybe questions.
Thank you, Dalida. Thanks a lot. Yes, today we are here together with Gavin Slade of Nazarbayev University. And Gavin is ready to give some comments on this work. I think it's important for us to know that Gavin has been working on prison history, prison reform for many years. He's a criminologist and yeah, has a great expertise. And so I think we can be very happy that he's here today to also, yeah, to maybe yeah, give some comments and also put Dalida's research in yeah, in a new perspective. I think we are very curious what you will tell us, Gavin. The floor is yours.
Okay, thank you. Thank you, Ulla. Well, firstly, I'd say to Dalida, congratulations, big congratulations on doing this work and, you know, passing the PhD. That's amazing. You know, I'm really happy to see that. I'm really happy to see prison research being conducted in Kazakhstan at a high academic level. I think we don't see a lot of that. And also, I know English language is sort of colonial, but it does help to make comparative research when we're able to read each other's work in international journals. And so I know as well, Dalida, you've been publishing internationally. I've read some of that work. Unfortunately, I haven't read your PhD. So I'm sort of going off the presentation and published articles, including the article that was Ula sent out. There was a link to it, which I think actually was a reviewer on. I remember that article coming past my desk. And that is a question I actually wanted to put to you, Dalida. I could ask you to speak a little bit longer. I'm sorry for that. But could you tell us more, before I give my comments, about the methodologies, the data that's actually been collected? What you've done in terms of collecting this data to understand some of these realities that you're presenting to us. What's this based on? So this is based on interviews, surveys with prisoners, with policymakers. Could you tell us more about that? Because I felt like the presentation was a great presentation, but didn't really tell us that much about that. So I'd be interested to hear more, please. Thank you.
Thank you, Professor Gavin. Thank you for being here today. Today I was talking only about women, which we had. It was one of the questionnaire, one of the point of my research. So during of my dissertation, I had questionnaires for women after release. I had questionnaire for prisoners who is in prison and for whom left 1 year before release, because according to governance, social support for resocialization starts 1 year before releasing. So that's why we choose this group of people. And I had an interview with experts such as social workers in HIV centers, social workers in NGO, staff from penitentiary system, of course. So to check and to see the whole picture of the problem of the situation in Kazakhstan, we choose these 3 groups. So we use questionnaires and interviews.
Right. So for example, the rates of HIV, is that self-reported, or is that medical record? Is that sort of been produced by? So where are you getting the data from? So I mean that you have this very, very high percentage of women.
We had a question about HIV status.
Mm-hmm. Right. I was it's just useful to understand where these statistics are actually coming from. I mean, so this is a questionnaire basically. So this is self-reported.
When we had a questionnaire with women after release, yes, there were more medical questions about HIV status and other about drug use, yes. But when we had questionnaire with people in prison, unfortunately, we couldn't ask about this because when I started my research, Ministry of Internal Affairs checked my questions and they asked me to remove some of the questions or paraphrase. So I agreed because otherwise I wouldn't have any choice to have this research with this group.
Yeah, that's understandable. That's understandable. So, I mean, I think that one avenue here is for you to explore actually the differences in the data that you collect from within the prison system with the assistance of the prison service, right, and the data that comes from data collection outside the prison. I mean, usually those two data sources can provide very different data, right, because of the structural pressures that are put on respondents if they're inside the prison system and they're outside the prison. And I would encourage, that's academically, at least in terms of scholarly work, you can do some very interesting things with that, right? If you've collected data inside the prison system and you've got data from outside the prison, people post-release, comparing how people are talking is very interesting. It can tell you something exactly about the types of pressures that are put on people inside the prison. So this is one idea I have, because as I recall, when I was reviewing that article, the published article, relying on survey data that often, I mean, I understand fully this is not a criticism in any way. Trying to work with the prison service of Kazakhstan is very, very difficult. I've tried to do that myself. This is not a transparent.
I think not only in Kazakhstan, in Central Asia.
Yeah, well, but I think there's variation even within Central Asia, actually. I mean, and it's an interesting aspect of Kazakhstan that I think it's possible that, well, again, that could be a question we have, but compared to certain, I mean, Kyrgyzstan, for example, whether it's easier there, I don't know if we have any Kyrgyz colleagues, whether Ula or other colleagues could tell us their impressions. In any case, there's an interesting aspect here that Kazakhstan has this narrative of gumanization and humanization. At the same time, the prisons remain very, very closed, especially for research. And the experiences you're having here in terms of trying to produce data from the prison system itself speaks to that. So this was one contradiction I find somehow in your research, which again is not a criticism. I think it's simply a consequence of the data collection process inside and outside prisons. So in your survey-based data from the prison system, you find that prisoners, I mean, this is a generalization of your research, but roughly speaking, I remember being surprised by this when I read the article, basically saying, well, prisons treat us pretty well, and there's plenty of opportunity for rehabilitation, right? They feel very positive about the opportunity for rehabilitation. And the data you're presenting today, which, if I can be frank and honest with you, I think is more interesting in some ways because it's collected post-release, and I think it's richer. And because of that, what you actually find, to my mind, is absolutely shocking neglect going on within the prison system. There's a huge missed opportunity in terms of intervention here, right? So you've got prisoners that are incredibly vulnerable, female prisoners in this case that you're discussing today, are incredibly vulnerable, who have these multiple vulnerabilities, and they're not being, it seems that there's nothing really in terms of post-release and within prison intervention. And that sort of, in my opinion, has some tension with previous findings from other research that you've published. And I think it's interesting to consider that in comparison, basically. So to think about what might be going on there in terms of how prisoners feel they should report and should talk about rehabilitation within a prison system versus the actual reality that post-release, what they're actually telling you about the opportunities that they had. Because I find the data shocking, frankly, like what you're telling us about the level of HIV, that's absolutely shocking, right? I think that's absolutely shocking. And then the lack of intervention and support being offered to these vulnerable women is also absolutely shocking. I think there's something really to be said there. So, I mean, okay, so this is just one thing I wanted to say. If you're comparing the different outputs that you've made and interventions you've made, Dalida, I think there's something really interesting to say comparing that. Hello, should I continue? Am I still on? I won't take up too much time. I've just got a couple more points. I think so so this question about the missed opportunities, like the extreme vulnerability of some of your respondents, and then the missed opportunities for any institutional support is just damning, it seems to me. And then, so I think, of course, Dalida, you're absolutely correct to call for a comprehensive approach, what you call a comprehensive approach. And I think I've got a question around that, basically, the comprehensive approach, like what you think comprehensive means. I mean, because I guess you say, well, it's everything. We just throw everything in there, you know, literacy, medical care, psychosocial support. I mean, that makes sense. That makes sense. But again, to take a critical mindset to this, we're often in contexts which have very limited resources, right? So the comprehensive approach we can put forward, but it seems just like a wish list, right? I would love to just be able to implement this, want to have all of these things all together right now, straight away. But what does it mean, I wonder, this comprehensiveness in your view? You know, if you're thinking about priorities, where do you put the priority? I know that might be individually based, but I'm wondering about that, because I'm also wondering about where that comprehensive plan comes in during the sentence, right? During when people are still serving their sentence inside the prison, because you mentioned that you had that as just like one of the points, right? Which is like, okay, we need to sort of have more social care in prison. Like, so social care, that's the big issue. There's not enough social care in prison. But I also wonder whether more should be said about what could be done inside the prisons beyond social care. So I'm thinking particularly about the idea of that you might come across a lot in Western, shall we call it, penology, about the porosity of prisons. That is that, you know, that they need to be somehow open to society. So society needs to somehow penetrate the prison so that when people leave, they're not just coming back into a society that they've been divorced from, completely separated from. So there's an interaction going on, which the idea there would be that you allow NGOs, for example, a lot more access inside prisons to assist with these types of processes, with a view to integrating people better as they're moving out of the prison system. And I just wondered, for me at least, when I was listening to you, I was thinking that maybe that would be my priority, rather than, okay, there's a certain social care network or institutionalization within the prison, and people leave, and then there's this comprehensive approach coming almost as people leave. That's how I sort of heard it, but maybe I'm wrong there. I don't know. Anyway, that's a question for you. I was just wondering about this idea, because again, in a context, I mean, so let's just be honest, in an authoritarian context like Kazakhstan, a big problem there is exactly this issue of the degree of openness and transparency within the system, and that is about allowing people access from civil society into the prisons, right? Which again, or in our case, allowing researchers to do research to understand really what's going on inside the prison. Because again, as you're finding, prisoners are saying when they're in the prison, you know, I'm fine, I'm happy, rehabilitation, I have all the opportunities, and it's obviously not true. So, this is one question, and that's very important again when we think specifically about women in prison, because women's institutions are often very limited. So one critique, and I don't know about this in Kazakhstan, you could tell us, but obviously you've got this issue of distance, right? So the issue that women can often be thrown and served sentences very, very far away because there isn't the availability of specific women's institutions, female institutions nearby. And that again is a question of the degree of accessibility and openness of the system to societally based organizations in assisting. So that's my question about comprehensiveness, right? I hope it was sort of clear. I hope that I'm sort of making these questions as you were speaking. Okay, I think, have I got one more question? I had one more question. Yeah, so, I mean, another question, okay, I think I've got two more questions. The second question is, these vulnerabilities that you see compounding, obviously they're structural. You know, there are structural factors that are producing some of this, you know, in terms of drug use, HIV prevalence. And a lot of this is before anybody even goes to a prison, right? This is way before anyone, you know, gets caught, convicted of any crime, goes to a prison. And I'm wondering as well, is there any research, or is that part of what you're doing, is thinking about how you might address the big structural issues that are leading to certain communities of people, certain individuals, having these sort of risk factors, so things like inequality, as you already mentioned, stigmatization, in the case of gender. So, I'm just curious about that, so that you don't have to give a big answer to that, but it's something I'm interested in, if that's part of the sort of research agenda for you. And then, so finally, I was just thinking again in terms of how you might publish this data and engage in the global conversations. And again, I just think I would be really focusing, if I was you, this is just my comment really, on the uniqueness of your data, that you've got some amazing data here. It's really impressive, incredible. And, some of the stuff that you say, Dalida, would be just very familiar to people working in, human rights, the stuff around the Bangkok rules, the Mandela rules, the big international frameworks we have for thinking about prisons and rights-based approaches to punishment. But what's really unique about what you've got is your data. So I'm just thinking about how you highlight that, and you can bring that into conversation somehow, if you like, to sell it to the international community of scholars. Like, how do you do that? I guess that's my third comment, is that. Okay, so I'll shut up. I think I took more time than Dalida did. So sorry about that. But congratulations again. I think this is amazing. Really superb. So well done, everybody, and well done especially to Dalida.
Thank you, Professor Gavin.
Thank you. Yeah, a lot of questions to answer. Dalida, please start, and then we can open up the general discussion. I also took notes. I think it's really interesting questions. Yeah.
About comprehensive, approach to social work. If to talk about Kazakhstan, a comprehensive approach in social work in Kazakhstan's prison system means, in my opinion, providing coordination, multi-level and continuous support to prisoners from admission until after release. So it combines social, psychological, educational, legal, employment assistance, instead of treating problems separately. And in my opinion, it's based on individual assessment of each prisoner, interdisciplinary cooperation between social worker, psychologist, medical staff of prison, maybe HIV center, and of course, continuity of support before, during, and after imprisonment. This is what is written in international standards. So, what social worker can make? It's the main role is individual rehabilitation plan for each prisoners. So the rehabilitation of the prison should start from the first date of arrest. So it shouldn't be like right now with working 1 year before release. They have to start their work from the first day of in prison. It means regular monitoring and adjustment of support measures, maybe such psychological counseling, social skills training, conflict resolution, stress, anger management programs with psychologists. And of course, family links. It is very important because the main fact for successful release is family for most of the in prisons. Inmates, it is family links, so it is very important for social worker to I think, to save these family links with relatives, parents, maybe children. No, and after post-release continuity, it's coordination with probation service. Did I understand for the first question?
Yeah.
The second question, as I understand, it was about risks, yes?
Yeah. So if you think about the bigger questions, the structural factors that produce risk.
After release, yes, or during of the release?
Before, like how. I mean, this is actually just a question about the research, right? Whether or not that is something that emerges in the research is something that you're looking at, or is it mainly looking at, okay, somebody becomes institutionalized, they end up being pulled into the criminal justice system, and how does the criminal justice system work with that person?
So to talk about risk, I think the main is for every person, it is social risks. These broken family ties, as I said, social stigma, discrimination, lose of social skills, because when I was talking with imprisonments after their release, they said most of them were sitting 20 years, 15 years, and they could even forget how to cross the road. And nowadays, as you know, time digital grew so fast, and most of them didn't know what is it, a mobile phone, how to use it, how to find their address, how to reach to their house. Lack of work documents, low education level. I think this, if we talk about employment and economic risks, yes. Psychological risks, because they had stress, emotional instability during all their incarceration. What else? Administrative risks, because they don't, there is absence of identity documents. If it is a person with HIV, he cannot go to the HIV center without document to register himself and get this medication. Also, they have problem with registration at place of residence, yes. Probation conditions, unclear legal status, no, and of course, health-related risk. This, I think, main risk before release for every incarcerated person.
Yeah, I see. I mean, I'm just, I guess, if I was thinking about this, so forgive me if I say something stupid here or it's going to be
No, maybe I didn't understand anything. Sorry for this.
No, I'm just thinking. So, for example, if you have such a high prevalence of HIV, I'm going to make some assumptions here, right, which might be completely wrong. And you assume that the rate of HIV is related to, intravenous drug injection, use of syringes, for example, right? So if we make that assumption, and so we say that, okay, so there's a community here of people who, are getting caught up in the criminal justice system because of drug use, let's say, because there's high prevalence of drug use, and that's leading to high levels of HIV. So then I might be thinking, okay, so what structural factors lead this particular group or this particular person to have a higher probability that they would end up, injecting drugs, let's say, and then somehow ending up in the criminal justice system. Again, if I make all of those again, those are assumptions, right? But I'm just thinking about it, like I'm just brainstorming it. So I might imagine that there are certain communities where drug injecting is higher, or the probability is higher. So there might be that you target resources to particular communities where you see that emerging. So for example, if there's certain drug routes where drug use tends to be higher along the drug route, there's just higher prevalence of drugs available. So then that is impacting on who is using the drugs. You might also think of certain interventions in certain communities. And I was just curious, basically, before anybody even gets wrapped up in the criminal justice system, because we know basically what's happening is people get wrapped up in the criminal justice system, then everything's getting worse, basically, to that person. I think you're showing that very well in your research, right? Basically, the prison system is not an intervention in which somebody is being cared for or helped in any way. In many ways, it's actually increasing then the risks that they're going to continue on engaging in certain types of behaviors that are damaging for their health and well-being. So that was my question, really, was before someone gets even wrapped up into the criminal justice system, whether or not there are targeted interventions that can be made as a policies that could be looked into. But I mean, that was just a question about generally, does that emerge as part of the research or not? Yeah. Anyway, so I'll shut up though. I need to shut up, I think, so other people can ask questions. Sorry.
Thank you, Gavin, for these insightful comments and questions. I think it's very valuable to have someone from outside the project to look at the research and come up with new perspectives. I think that's very, very interesting. And indeed, this structural vulnerabilities is something that deserves to be studied. And then it is, I guess it's very difficult to do this because if I assume that people end up in prison, yeah, so we do not know why they're actually there. Yeah, so in that moment, we only have them at that moment. Yeah, so of course there's a whole history. Yeah, and this history is a history of probably of injecting drug use. It's a history of vulnerability. It's a history of social inequalities, and it's a history of exclusion that all led to this, to the situation. And I think what we can really see is that among women in prison, the percentage of women who use drugs is very high, and therefore the percentage of women who are HIV positive is very high. It's just coming together. And then, yeah, of course, it's really interesting to see what is the whole history that led to incarceration, because it's probably a lot of these things that led to the imprisonment also are related to drug use. Yeah. Dalida, I would be interested to hear if because you also conducted interviews, so how the women in prison, how they tell their stories. Is it that it all started with drug use, or is it that they give other reasons or other explanations, or as well? I think that would be interesting. How do they see their own history? And now you're muted.
Sorry. When I conducted interviews, no, just talks, yes, and questionnaires with women, I asked them about the history of drug use, and in my questionnaire, most of them say that they drug used in during of their incarceration, and the most of them used heroin.
Mm-hmm.
And about syringes, unfortunately, they didn't have their own syringes, and they just used 5 4 persons, just used one syringe. This, of course, very bad for their health, and some of them knows about HIV status of their partner, and I think because of the stress, because of the health issues, um, the addiction, they couldn't stop and just agreed to use with this person. And I remember that one of the, not one, but their answer was like they just washed it underwater, the
Mm.
series, and used it again and again because there was not availability to change it, to get new one. So it is very bad, but because of, I think, stress, psychological problems, some of them started to use drugs during of the incarceration. For example, before they didn't use, but then they started to drug use
In prison. Okay.
in prison, yes.
Mm.
But after release, all the uh, representatives, yes, answered that they don't use drugs right now in society.
Mm-hmm.
So the level of using drugs in prison very high.
Mm. This brings me to
They,
a second question. You mentioned that there's this training program,
yeah.
trainings for social workers in the prison system. I would be interested in how is the program of this training, the curriculum, how is it made? Who is writing the program? Which topics are addressed? Who's deciding this? I would be very interested in this.
This training was not for social workers, for
Mhm.
prison staff, because as I said before, we don't have social workers. This training for staff and prisoners. For staff, we show how to work with disabled person. How to move this person if the person cannot see, cannot stay, if the person just lay, how to care about this person. Also, we give information about international standards. We give information about, I forgot this word, NPM mechanism in Kazakhstan, that which rights these prisoners have, or how they can get them, what they need. These such of trainings we have right now. To be honest, in this year we just started in December, and the program is still developing. So right now we see what is interesting, what is helpful for them, and on the next year we will already, I think, create a new program which will be for every organization.
Okay, thank you so much. Let us open the floor for questions from our audience. I see a lot of PhD students here and also some other members of the Solid network. So please ask the question that you have. You can either raise your hand, write a question in the chat, or just start to talk. That's also possible to speak, and then we see who has a question. So all things are possible.
It is very interesting right now training in Uzbekistan
Mhm.
about how to work with people who use drugs in penitentiary system.
Right. So is there a cooperation between Kazakhstan and Uzbekistan?
No, it is national training only for Uzbeks.
Okay.
But Shahnoza allowed us, thanks for her, to
You're
connect
welcome.
online. Oh, Shahnoza, you're here.
Yeah, thanks to Charos. I came to see her, but I just very busy. Sorry for me missing last meetings because each week I have an event. One in Bishkek. Now we have national training, which Dalida just mentioned. Yes, she's attending it.
Mm-hmm.
Thank you, Dalida. But as it's national training, I've allowed narcologists from from 4 Central Asian countries to participate, but like in standby mode. Yes, so Dalida is attending this training.
That's great. Yeah.
Yeah.
So so that's a training organized by or provided by
UNODC.
UNODC. Okay,
Yes.
great. Mm-hmm. And I assume that you use the international standards, prison standards?
Yes, of course. We present international standards. We have like a trainer from San Diego, Igor Kotseniuk. She used to work for UNODC previously. Now he's a professor of San Diego University. He has lectures on treatment of drug use disorders. Also, we're covering such topics as HIV, hepatitis C, TB. So tomorrow is our last day of the event.
Good luck with this, Shahnoza.
Thank you, Ula. Thank you.
Yeah. I think so. We see here that this network approach, different people working at different organizations, that's so important.
Yes, and I can say you, Ula, it's a historical moment as the Ministry of Interior approached us that time. I think it was in summer, and they want to work on the rehabilitation of people who just released, and reintegration. And I've told them that we have some funding, very small amount of funding, but and we can help them with the capacity development and raising awareness, and we proposed that we can conduct such kind of training. So they immediately agreed, and now we have probation services, interior services, Ministry of Interior, then Department on Execution of Punishments, different agencies, NGOs in one room. Can you imagine? So I'm really happy that it's happening, and I really do hope that it's the beginning of something new in the Republic. So I will let you know in coming years if it worked or not.
Yes, that would be great.
Great.
Yeah, I mean, it brings me to another question. So, Dalida, you started to tell us about the vulnerabilities. I would like to know what are the sources for social support? Is it the family predominantly? Is it community groups, or so is it social workers, worker? So maybe you can tell us more who's actually providing social support.
Right now in Kazakhstan?
Yeah, for women in prison. So, and what are the sources? Yeah, because that's I think it's very important in this case.
I think the key role right now plays NGO. It is very good because our penitentiary system become more open and allow for some NGOs to come, not every day, but to come and to talk with them, to have some groups, support groups, to show them, give some information about where they can go after release, where they can find a place to have a night. For example, if their house very far from this city. Also about government right now helps, like I think it's after release, they give some financial support. It is not a big amount, but anyways, it helps to buy a ticket and by train and reach their house, family who can help them. What else? I think yes, it is NGO.
And these NGOs, are they mostly established by former prisoners or by former drug users? I mean, is it like some kind of community self-service, or is it NGOs that are set up by social workers or medical doctors? I would like to know more about that.
Thank you for your question. To talk about NGO in Kazakhstan, we have different NGO with different direction. Some of them work with prisoners, some of them work with HIV people, some of them work with drug users, yes. Of course, HIV drug use very close topic, but it is very hard, I think, for them to work in different directions. So that's why they choose, for example, to give some psychosocial reintegration programs, yes, community support groups, maybe advocacy and stigma reduction.
I see. Yeah.
Legal employment assistance also.
I see.
Supportive
Yeah.
services, I think.
Could I add some information about this NGO who is running with post-penitentiary probation? They mostly have funding from government. We have the special Dalida, который государственная социальная заказ, the government social order, and their NGO could, for example, win the tender, and they to provide services. It's sometimes around 1 year or even, for example, 2 years, and they providing services in regions. And as you know, also Elena Belakon, she's running with same NGO in Almaty. They are running not just with after release, but also during, because you know that there is several types of probation. They also working with prison probation term. And there is some very active NGO in several regions. Mangostau, the East Kazakhstan, Karaganda, Pavlodar, and one my colleague recently, she's not a social worker by diploma, but she's active one, but she's not from this community. She's not drug users, but she's also running with such services in Karaganda region, and she's also very active. She's providing recommendation to government, to regions, etc. Why? Because the government have no established yet human capital to support, for example, people after release, and they imagine that it's very how to deep and big needs in this question, and this is why they're providing money for that. But as Dalida mentioned, we have no social worker in penitentiary system yet. But there is some projects, especially UNDC, involved 500 theologists in prison settings, and they are running with case management, which is a good basic ground for us to do more and to, for example, widely go with case management to this, for example, system. And Dalida didn't mention today because her focus was on the woman, but she's also was how to say, author of we are called professional card as a part of professional standards for prison settings, and in future it we will call a professional standard social worker in prison settings. And we agreed preliminary with Ministry of Internal Affairs. I'm a head of National Alliance of Professional Social Workers, and we did signed memorandum this year, and they are ready that we will develop these professional standards, and I hope with solid second phase support we could do that, and so to provide them comprehensive, comprehensive basic background information with from international cases, and it could be good ground. For example, how looks a professional profile of social worker in different prison settings, and it will be great. And this is why Ula, I'm planning to put in our next year timeline several probably discussion round table with Ministry of Internal Affairs and with colleagues around the world, and would be great to help them because they are they're ready to they're ready to discuss and seeking help from us. And as colleague from Nazarbayev mentioned that it's about the numbers, etc. But the data shows that around the world, the situation with HIV transmission, it's quite higher. It not in Kazakhstan or Central Asia because it's close institute and there is another factors, etc., etc. And as Ula mentioned, there is a background content. We have zero idea what's going on. Sometimes even prisoners, women could be victims of human trafficking also, and this is because they are vulnerable because they are drug users, and this is also could be very deep cause why they are now in prison, etc., etc. And it's briefly I tried to add because it's a very short short presentation. Dalida couldn't, for example, to say more about she did also in her work.
Yeah, the link with human trafficking is definitely worth studying. Thank you, Dinada, for outlining this, and I'm really happy that there are some nice roundtables coming up. As a last question, I would like to know from you, Dalida, do you have recommendations for the solid PhD students? Can be very general, can be very specific. As I know that many of our audience today are new PhD students.
The first one, maybe, as you mentioned, Professor Ulla, about network. I want to say that network is very important, and Project Solid helps in it. It's a great opportunity to get some theory, practice, information, use this information for their future research. What else? Just not to lose any chance to get some new knowledges about methodology, about theory. So, and read, I think, more articles, research about their topic. Not only strongly strict about topic, but all close to the topic. And project allows you to participate in different conferences. So try to write some articles, abstracts, send them, and participate in not only in oral presentation, but in maybe just a participant. Maybe this.
Yeah, thank you. Some more question from the audience? I think everyone has asked his question, or is there someone?
Well, can I just make one
Yes,
last comment?
sure.
I'm just curious. So again, it might sound radical, or I mean, just to the point about the statistics. I mean, I still would insist that percentage of HIV prevalence is very, very high. I don't know which global comparator you could take that could find something quite that high. Which leads me to believe that there's a very particular group of women who are getting caught up in the prison system. So I was curious though, thinking politically, sorry for a political comment, but I often feel like the comprehensive approach that you're describing here, I mean, it's very difficult to implement. There's lots of obstacles to it. It involves lots and lots of different aspects. And I'm just curious, thinking about decarceration. I mean, it seems to me that the best way to sort of have a rights-focused, helpful approach to these particular populations is to try to change sentencing laws, I guess, the sentencing guidelines, like how long people are being put in prison for these particular types of offences that these women are going to prison for. You know, we have a hangover here from the Soviet Union, right, in terms of very long prison sentences being given out. So I'm just thinking about the comparison with juvenile justice, where across what used to be the Soviet Union, we've seen this huge decrease in the number of juveniles incarcerated because of very, very targeted reforms and pressure put on governments to make reforms around sentencing of juveniles and diverting them out of the criminal justice system. And I was just wondering again whether that's a part of the solid purview, the solid agenda, is looking at those sort of, if you want to call them, front-end processes. You know, how do you divert these vulnerable women out of the criminal justice system in the first place? So it's just a comment. I'm just curious about that. Thank you. And anyway, that's enough from me. So thank you for this. Thank you for this talk. I really enjoyed it. It was very interesting. Thank you.
Yeah, thank you. I mean, that could be also a nice starting point, you know, like just take this one, the high percentage of women with HIV among the overall population of women in prison, and just, you know, like use this as a question for a short article that could even be very interesting in itself. Because what we also see is overall in the world, UNAIDS now receives a lot of less money. And the general idea is AIDS is over. Yeah, so of course there are still people living with HIV, but that the pandemic is over. But what we see is that there are new vulnerabilities and in parts increasing infection rates. But there's not, I mean, in general, not much data about that. So to just pinpoint to a very specific group of people and just to show this, yeah, could already be very important.
But pandemic is not over over yet, but it's imagination of some politicians, let's say, because now it goes in general population. We just have no idea how to identify, because in my country just we have send six group of people to check the status, but not the general population, because parental transmission it's not actual. It's about another story. It's not over, I would say. And it's the first point. The second point I want to reflect to the last comments of professor from Nazarbayev University about how our project, what we think about the juvenile justice, etc. Because our topic is treatment and prevention, and we are quite okay with the treatment, I would say. And if we could talk about the prevention, what we could do, we I'm very glad to see in Nuremberg in October that our colleagues from Uzbekistan choose the topic in the prevention fields and work with youth, with the population of children, etc. And in Kazakhstan, what we are thinking about, I'm also thinking to put in our probably next year's agenda to we are trying to promote now idea to involve social worker in juvenile court, for example, for children to prevent increasing kids population in prison, which is not good because it's not a good place for them to be in. And this is why we should develop alternative ways, for example, how to deal with that. And another, if we could follow this continuum, prison, court, and in school is a very, how to say, very important topic to work with. And places we are in our agenda of our national NGO of professional social workers to promote to discourse about school social worker, because we know from the German experience, etc., and USA, they have even association of school social worker. It's very important to promote, again, to have a how to buffer, let's say, emotional even buffer to prevent, for example, this drug addiction or another kinds of addiction. And yeah, we have no anyone colleagues in our Solid Kazakhstan team with such topic, but probably we will see in the next another, for example, years how to incorporate in our agenda after probably completing with professional standards for international for prison settings, but we'll see. But anyway, it's very actual because now we're dealing with people who are already in prison, but we need to think about how to prevent such addiction, which sometimes, because it's very often when you could see, you could find out, for example, mostly males, they had in the past alcohol addiction, for example, and now they became into prisoner, etc. Even about use, it's also actual. Okay. У кого микрофон, коллеги?
Я выключила. Все нормально. Okay. Thank you so much, Dinara. It's good that you put the things in a broader perspective, and we see this is an immense effort. Yeah, it's an effort of professional social worker, of the alliance, of scholars such as Dalida and Gavin and you, and also of the project. So I'm really happy that we had this talk today and that we learned about some new insights from the Dalida. Thanks everybody for being here. I will now stop our recording